My name's Heath Kirshner. I'm the Executive Director of the OrthoForum Value Network. I'm excited to be here today, which I think is, given the panel, going to be a very lively discussion around how independent orthopedic practices and our physician entrepreneurs are really leading consumerism in healthcare. Delighted to be joined on stage by three very familiar faces, all OrthoForum and OrthoForum Value Network family members, but who are also leading the charge in the industry by developing innovative solutions that are promoting, which big topic earlier today, with price transparency and increasing access to care for employers and their patients. So I will let them introduce themselves in a minute, but just with quick ways of introduction, we have Dr. Brett Miller, orthopedic surgeon from the Orthopedic and Sports Medicine Center in St. Joseph, Missouri. He's also the founder of HERT. Dr. Mike Havig, again, orthopedic surgeon from OrthoCollier in Naples, Florida, founder and CEO of HealthMe. And then we have Jerry Cook, VP of Sales of OrthoLive, which was also started by an orthopedic surgeon by Dr. Michael Growie from OrthoCincy in Cincinnati in Ohio. So with that, I'll hand it off to you, but I know most people are thinking, orthopedic surgeons, aren't you guys busy enough with seeing patients and running your practices? Can you tell us a little bit about yourself and what motivated you to take the leap to kind of start your companies?
Yeah, sure. I guess I'll go first. I'm Mike Havig. I'm an orthopedic surgeon in Naples, Florida, and HealthMe is basically a marketplace for transparently priced, bundled musculoskeletal care and moving into other specialties. I didn't set out to, start a business, right? I was just seeing a problem in my community, which is a problem Dr. Van Horn referenced, where he gives his grad students, call around and see how much it costs, and none of them could do it, right? So I practice in my hometown. A lot of my high school friends are small business owners, right? So they don't carry insurance. They make good money, but they don't want to pay $30,000, $40,000, $50,000 a year in premiums and deductibles before they see value. And they were literally calling my office trying to get in to see me. And we had a self-pay policy like everybody else does on a piece of paper. And my staff was telling them, no, Dr. Havig only takes care of insured patients. And I would have never known this if I wasn't called out on it by my own friends, right? They call me at night saying, hey, what the heck, trying to get my kid in to see you didn't, what's wrong here? And man, we couldn't figure it out. I'm like, we got a piece of paper, we got pricing. And what I realized is the end of the day, healthcare is retrospectively priced, meaning you see the doctor, they do a bunch of things, they add up the price is way up here somewhere crazy, Medicare pays this, and everyone else is somewhere in between. And so we're asking our staff to do the impossible, which was predict the future, right? What's it gonna cost? What's the doctor gonna do? Once they have a cost, then negotiate that with the patient, then collect that money. And so I realized, hey, almost everything we do in musculoskeletal care and healthcare in general can be bundled. And if you have a bundle, now you got a product. If you have a product, you can put a price on it using data. Once you have a product and a price, now you can retail it just like any other business. So at HealthMe, we help musculoskeletal practices bundle price and retail their services, starting in the local small business, uninsured, underinsured space, giving these people access to care, but now moving into the self-funded space. So excited to work with the OrthoForum Value Network and all these great entrepreneurs on stage. And it's looking forward to this talk. It's a lot of fun.
Dr. Brett Miller, I'm an orthopedic surgeon in St. Joe, Missouri. And last night at the cocktail hour, everybody would look at my badge and they said, well, what's HERTY? Well, it's HERT with an exclamation mark. So it's not HERTY. But we all created these companies out of a problem that we saw in our own practices and our own communities. And really the basis of what HERT is I live in a small town and essentially my home is like an orthopedic urgent walk-in clinic, which means that people know who I am. They have my cell phone. They'll come to my door. I'll check them out evenings, nights, and weekends. So after seeing case after case after case inappropriately triaged to the ER, self-triaged, and I'm a huge Marty McCary groupie, so I can quote a lot of his lines, and I really believe in what he's doing. But precision of care and appropriateness of care, those are two big drivers of what this platform was designed to do. We know that if you can just talk someone off the ledge, just Sunday, 2 o'clock, you're playing pickleball, you feel a pop in your Achilles, what's your gut reaction? it's to go to the emergency room. It's absolutely wrong. It's wrong 99.9% of the time. That's a $3,000 mistake. So if we can just say, talk you off the ledge, go through the app, get some basic advice, then see our orthopedic specialist on Monday morning. You still got plenty of time. Now we can just change this whole journey. And really we talk about the topic of this that I helped kind of tailor is consumerism. The net promoter score in healthcare is abysmal. It's embarrassing. And as Mike said, we're embarrassed whenever our friends and family try to consume healthcare from us. And it's almost embarrassing whenever we can go consume their products and services very transparently. So that's the nature and the genesis of Hurt. And we're just trying to bring that whole experience to consumers, just like you all are here today.
Well, thanks so much for having us, and thanks for the intro, Heath. My name's Jerry Cook. I work with OrthoLive. I'm the Vice President of Sales. So I've been with OrthoLive for about 6 years, and Dr. Mike Greiwe, he's an orthopedic surgeon out of Ortho Cincy. He started the company when he wanted to give really quicker, he wanted better access to care, specifically for people in rural areas, and he wanted to give orthopedic surgeons that access. And as we started treating patients through the OrthoLive, the original app, and orthopedic surgeons were using it, we realized that there was a need for employers to have that same access. And the way I say it is that quick access to great care at a reasonable price. So we transitioned from more of a software company to being the actual clinic and to working almost solely with those large employers to give quick access to great care. It's everything I heard this morning from the speakers that you mentioned. It's not just the commercial insurance side; it's the work comp insurance side as well. There's significant issues when it comes to access, and then when it comes to the right care at the right time. You talk about a $3,000 mistake. It's for that pickleball injury, and I know you guys know this as well, it's also for that sprained ankle or that shoulder injury or whatever injury that you get when you're in a manufacturing plant. When you step off your truck and you twist your ankle or something happens, you can make that same mistake, and this time it might not be for someone's personal finances, but it's for the company, and the company gets really hurt like that. And I heard someone earlier say that if it's good for the company, it's ultimately good for the employees. And I couldn't agree more. And so OrthoLive's, our goal here is quick access to great care at a reasonable price. And we feel like we've done that over the last 5 years, and it's been an absolute blast. So excited for this conversation today.
Perfect. So Brett, or Dr. Mill, you brought up kind of consumerism, kind of the big theme of the talk here, and consumer-driven healthcare. And, one of the challenges in consumerism is, the patients aren't always able to be able to access and consume care in efficient ways. So each of your companies were built to basically reduce those roadblocks for the healthcare consumer. How can you tell us a little bit more about how your platform increases access to care, and kind of even more importantly, how are you helping push the concept of value-based care forward?
Sure. There's a lot of point solutions, and that term's used. I know there's a lot of benefits brokers here and TPAs. All of these products are great, but they're only great if we use them. So how do we engage the consumer? How do we get people to use our great platforms? These platforms are all great, but they're only great if people are using them. So out of necessity, you have to learn to market. And I hate marketing, but I'm becoming a quasi-marketing expert, because you have to learn to market. I know there's a lot of direct primary care docs here, and that's a big driver, but how do you get people to come to you? And so I think you have to really engage the marketing piece of this, and it's not just boosting social media and creating TikTok videos. It is really to find that special relationship, whether it's an agency, whether it's you hiring in-house marketing, but you have to learn to engage consumers. Healthcare, again, is terrible at it, but other industries are really good at it. So we are learning to take the path and the advice of other sectors and get consumer engagement. In 2022, Hurt had 1,000 registrations. Last week, we had 1,200. So we are learning through watching our other sectors on how to engage consumers.
Dr. Havig?
Yeah, so I think, going back to the core, one of the core FMMA principles is it's about pricing transparency, right? So if you want to access care and you have a high deductible, I think most employees, even if they work for a self-funded employer, it is tough to engage them, as Brett was saying. But I think if people, I feel if people know the price, quality is the other part of the value equation. Harder to measure in healthcare, but measurable, and Dr. McCary and others have done a lot of great work there. But at the end of the day, consumers kind of know to some degree what they need, and when it comes to basic stuff, I think we all underestimate the ability of consumers to figure out their own healthcare. And I talk to a lot of people that are industry incumbents who are like, what are you talking about? How would a patient know what they need? Well, it's pretty freaking obvious, right? I sprained my ankle on the pickleball court. I need my ankle looked at. I don't care what the ICD code is. I don't care what the CPT code is. I just want my ankle looked at. Oh, and I get my ankle looked at and get an x-ray, and I can do that for $200 and change? Yeah, count me in. So we took care of about 20,000 patients last year, episodes of care, of mostly retail payers, right? So we started in the retail space, just local people that aren't insured or underinsured, and guess what? They can figure it out. And I think at some point we'll be able to connect, put that data in front of patients. Here's what you get. There's the product. There's the price. Patients can figure it out. And I'm not talking about complex ICU care or cancer care or things like that, but for probably 80 to 90% of what healthcare consumers need, it can be bundled, priced, and if they know, they can get access. They can pay for it. They can afford it. They can budget for it if it's a surgery. They can get financing for it through platforms and partners that we have and things like that. So at any rate, like anything else, you want to buy a new computer? Hey, this is the one I want. There's the price. Let me shop it around and find it. You buy it. Healthcare can be very similar. And so that in a nutshell is really what we're trying to do. Just bring that transparency to the consumer.
Yeah, let's change the mentality in general, right? I mean, I think that's what we're all saying. So you have, I don't know, let's use the employer space for a second. You have a risk manager that's been at a company for 20 years. The only thing they know is insurance, billing for work comp claims. And the only thing they know is sending somebody to the clinics that you were talking about. And it's not crazy to them to spend $3,000 on an ankle injury because that's all they know. So when you talk about consumerism and engagement in these things, you have to change the mentality, whether it's on the commercial insurance side, whether it's with the clinics, the hospitals, the employers. The mentality has to change. And so one thing we try to do at OrthoLive is help them understand, it doesn't have to be the way it's always been. You can have a value-based program in work comp. You can have a value-based program on the commercial insurance side for a large employer. You can have a bundled pricing program, and you can treat a work injury for a certain amount of money that's costs way less than your standard billing program. So I think changing the mentality is really important. It's your typical innovation curve, right? And I don't know where we're at in that yet. I don't think we've peaked by any means. I think we're still on the early side of it, but hopefully, events like this will kind of get the word out more. But we really need to help employers and consumers and everybody that is actively engaging in healthcare. They have to understand that we're all a part of it. We're all a part of it. It's the risk manager at a large employer. It's you when you sprain your ankle, and it's utilizing tools like we have to help move the needle forward, help move the ball forward in this game. So yeah, I really think changing the mentality is how you get consumers more engaged in programs like these.
Completely agree. So Dr. Miller, and then we'll send it over to you first, Havig. Mentioned about all the different point solutions that are out in the market. And I think there's probably almost you're starting to hear the work term, little point solution fatigue out in the market, and everybody's competing and doing them things. And we're trying to figure out ways to better connect all the different point solutions for patients and doctors in the purchaser community. Kind of what are your thoughts around ways that we can connect all these different point solutions?
Yeah, I think that's the things. One of the things I hear from our practice clients, our physicians, is a term that was new to me a few months ago, and now I hear it a lot, is vendor fatigue, right? So there's a lot of people doing a lot of things, and there's a lot of blue ocean in this market. So as you know, or Jay discussed earlier, you know, a lot of us are, you know, quasi competitors, but I think there's so much room to grow this. And one of my missions and why I love coming to a meeting like this is to meet other people in the space and figure out ways we can connect, right? So we've tried to build our platform to be pretty agnostic, and we're happy to work with anybody, even if they look like a competitor on the surface, because if we get the word out and get the product in front of more patients and more employers and more payers, we all win, and there's a way to do that. I'm very excited about the OrthoForum Value Network, and I'm going to kick a question back to Heath here just because I don't want to steal his thunder, but a lot of you don't know what the OrthoForum is, so I'll do that. And he can talk about the Value Network and how we're all plugging into it a little bit. Not at any rate, but the OrthoForum, I'm a member of the OrthoForum, something called OrthoConnect. It's a business consortium of about 5,000 orthopedic surgeons, independent orthopedic surgeons, I might say, not private equity owned, not university owned, not hospital owned, independent practices, represents about 25% of the practicing orthopedic surgeons in this country. And the OrthoForum, through the leadership of Heath and Karen Simonton and others, have said, hey, why don't we bind all these folks together? And, you know, we're helping getting out the, you know, lifting the bundling and pricing. You know, Brett's, you know, working on the engagement, OrthoLive's doing the digital first thing. But it's really exciting to start connecting some of these pieces of the ecosystem and hopefully many others that are out there. But sorry, I probably said everything, but any other thing you want to add to the OrthoForum Value Network?
Yeah, I mean, I think that's one of the things we're trying to do is connect all the different dots and develop a comprehensive musculoskeletal solution for employers and patients to increase access, provide affordable health care at the right time. So to kind of Dr. Havig's point is, you know, we've taken all the memberships within the OrthoForum and the groups across the country and created a clinically integrated network. So we have 150 orthopedic groups, 100% independent, 5,000 providers, 4,500 therapists. We're in 45 states. But we're taking kind of that in-person network that we have that offers the full spectrum of MSK services, but really promoting price transparency through companies like HealthMe and integrating, you know, virtual urgent care facilities. So all of our groups are providing 24/7, 365 access to healthcare, and then layering on an OrthoLive that has the digital first virtual PT visits. So between between all of our different partners, we're able to really meet the patient wherever they are in that MSK journey and provide them with fully transparent pricing as well. So that's the extent of what we're looking to do within the Value Network and start working with benefit advisors and employers to kind of embed our solution for their members. So Brett, I mean, as far as connecting the dots in the different vendor solutions, I mean, how are you working together with to try to bring that together?
Well, I think it's very complicated because just like it's been said, the number of people knocking on your door to sell you something or try to engage you, it is fatiguing. And I'm on LinkedIn pretty active, and I try to respond to every single request, and it's almost unmanageable now. My network has grown immensely, but I still try to have that because you just never know. You just never know who is going to hit next with your platform. So creating a broad ecosystem, I think, is critically important. And we're trying to encompass all of MSK on this stage. We can't all do it by ourselves. As Mike said, the ocean's big. And I think if you try to be the only solution, I think you'll fail. Again, going back to precision of care, that's this sort of subspecialty mentality. And I think there's some value in that. I believe in, the global generalist care. But when it's really dialed down, and we know if you rupture your Achilles, you just need an orthopedic surgeon. That's it. Now, if you have knee pain or back pain or sciatica, you need a lot of different people. You probably need a physiatrist or a physical therapist or a chiropractor. So when we can dial this down and we have an ecosystem that we can refer internally to, I think that's how you engage the Home Depots of the world, all these other people that are trying to sort through what solutions do I want in my benefits package.
Yeah, and I think it's also how you solve vendor fatigue. I think that was a really good point. And sometimes that burden is on the employer, let's say, to go out and find their own package of vendors, and that's tough. You typically, even big companies I work with, you typically have a few people in a risk department, and they shouldn't have to be the experts to link that up. In a sense, it should be us. It's because I believe the vendor fatigue is somewhat solved if let's say they started with us and we could say, hey, well, we are partnered with the OrthoForum Value Network, so you don't have to go find a network of great orthopedic surgeons because that's part of our network. And so I think if we can really play nice, if we can really connect our networks together, we can all shine in our individual places, then I think that benefits everybody in a much broader perspective.
Switching gears a little bit. So what are some of the problems you hear from your patients, physicians, and other clients that need to be solved when you look at kind of the FFMA movement? And what are you building to solve these problems? Or kind of how has your company evolved over the last few years to kind of react to the market? Dr. Havig, go for it.
So a couple of things. One thing I'll comment on is, we're orthopedic surgeon founded companies. And I guess one thing, just listening to the talks up here, is it's the entire continuum of care. So what I was hearing from people early on, this isn't a new thing. I'll get to something new in a sec. But one of the things that I realized doing this for my own practice is it's not just bundling surgeries. I think everybody here thinks of an orthopedic bundle, they're thinking surgeries. Now, it's surgeries. In my practice, 1 out of 10 patients I see gets a surgery. 90% of them I cure non-surgically. And so we're really kind of to some degree, people would say the primary care docs, the musculoskeletal system, the AOS. Our academy was trying to promote that a number of years ago. They failed, in part because we're our own worst enemies there. But at any rate, like a lot of what we do is non-surgical. So I think the point is they see their primary care doc treats them. Now they need a referral to a specialist. And in orthopedics, it's like, that's the orthopedic surgeon. Now, a lot of companies would paint us as the boogeyman. Oh, they're just going to operate on everybody. But again, 90% of the time, I cure my patients without surgery. Even people that refer to me for surgery. So anyway, we offer the entire continuum of care that's bundled and priced, right? Starts at the office visit. That's where the patient accesses the care. Like I get referred to people like, this patient needs a surgery, and it's like, well, who determined that? Like the work care clinic at his company plan or something? It's like, which is sometimes right, but it's like an MRI. And I look at it and I'm like, this guy doesn't need surgery. He needs an injection, needs physical therapy. So I think it's critically important to offer the whole continuum of care. Office visits, procedures in the office like injections, physical therapy, imaging, and then surgery if needed. And that way the patients get access to care they need. They get the right care. And so that's something we've been doing for a long time. One of the problems that we started hearing serving this retail market is, well, there's not enough people who bundle and price their services, right? I mean, Keith and the FMMA have been at the forefront of this, obviously. But how do we bring that to more folks? So, and then once we've done that, how do we get in front of employers? So recently we've actually built a platform that allows, navigators in that system to help kind of interact with OrthoForum Value Network clients and others where they can access that care easily. And so we're really excited about that, is to get into this kind of self-funded employer space and connect our doctors with the demand that's there.
Yeah, absolutely. Dr. Miller?
I think that if anybody in this room wants a reservation for dinner tonight, who's going to pick up the phone and call a restaurant? I would bet no one. We're all going to use OpenTable or the website to get onto that reservation. And if they don't have that, we're not going to that restaurant. This is what healthcare is missing. And we're a right now society. We're all doing 17 things on our phones and paying half attention. It's the way we are now. So if we can't get immediate attention to our problem, we're moving on. The one thing we found at Hurt, I thought we were going to be this great company that saves millions and millions of dollars. But really what our consumers our feedback is, they want rapid response and they want right now results. So if you're a mom and your kid is injured on the soccer field and they're wailing in pain with their knee, you don't care what it costs. You want that problem solved. And that's really the start of it. But we knew that if we could solve this in orthopedics, which I would probably argue might be the hardest specialty to solve it in, with the risk and liability that goes along with compartments. I know there's some med students in here. Please don't use the word compartment syndrome when you call an orthopedic surgeon. Just say, There's some swelling. I'm sorry, that's a side note, but you get that too, right? So med students, talk to me. So if we can apply this model to the very high risk orthopedic specialty, and that's the reason our malpractice insurance is $40,000 a year, because there's significant risk in this space. If we can do this virtually, then we can do this in a lot of specialties: ear, nose, and throat, GI, probably not oncology, but there's this model applies across the board. And so we started here, but it's not where we're ending, because that's what consumers are demanding, and that's what we're trying to help solve.
You know, you mentioned earlier about the $3,000 mistake. I thought that was a great place to start. And one of the pieces I took from that was a problem that I hear all the time, and that's that when my employees are injured, they rarely, well, before OrthoLive, let's say, they rarely see the right type of provider at the right time. So they go to the ER, they go to a clinic, they go to an urgent care, a walk-in, and that is the start right there of one of the biggest problems that we see. And there's a lot of problems. So first, you know, we talked about it. It's just generally expensive not to start at the place you should start at. It's just going to cost more money, and you're going to end up seeing one of these guys anyway. It's just going to be a longer and more expensive road. So if you can get people connected to the right provider almost immediately, it's going to cost a lot less, but and they're going to get treated a lot quicker. But then if we go on sort of the more sensitive side, and arguably the more important side here, you talk about the kid wailing in pain. I mean, whether it's a kid wailing in pain on a soccer field, it's I always make the joke, it's been 15 or 20 years since high school football, and everybody thinks they're tough, and then they finally get hurt, they trip off a forklift, and they twist their ankle, and they say they have 10 out of 10 pain, no range of motion, and they're crying. And it could be a minor ankle sprain, but they don't know what it's like to get hurt. They haven't been there in that spot in a really long time. If you send somebody to a clinic, they're going to get prescriptions, they're going to get time off, they might walk out of there with some opioids. We talked about that earlier, right? And that's a tough road to go down for a lot of people. That's a whole other 30-minute chat at least, right? But if you can really offer patients the quickest access, not only to great care, but the right care, it's going to do a lot for them. The company's going to spend less. They're going to feel a lot better. And so the biggest problem that we see is really wrapped around all that. And I'll give you an example. I mean, we started working with Chewy.com. If you have a pet, you probably know who they are, Amazon for dog food, let's say, right? And we started working with them about 4 years ago. After 3 years, they saved over $20 million working with us. TrueLive is a large cannabis company. They saved almost $1 million their first full quarter with us compared to the same quarter the previous year. And it's not a magic, we don't have a magic wand. It's really just doing what everybody here has said. It's just understanding what the patient needs at the right time and just getting them quickly to that provider and getting them connected to the right person and getting them the right treatment. So, the nice part is I don't think these problems are difficult to solve at all. I think that if you just connect the network, I don't think they're difficult to solve. I think that's what we're here for, right? To solve these problems pretty easily.
That's a great segue, actually. Dr. Miller, go. You want last
I was just going to say, these are all simple solutions. There's nothing brilliant about any of this. It is basic, common sense stuff. The absenteeism that goes along with inappropriate care. If you have a job and you only have so many days off and you have to take your kid, to find that you're going to get referred to somebody else. It can be orthopedics, it can be anything. It's just, that is that's hard to measure. My cousin has a large construction company. If one of his guys on a crew misses a job and they get behind, it's a major problem. We don't even talk about that. So that's a whole nother can of worms, that fixing this access problem is critical.
Great segue into the last question. Jared, you kind of hit on it, and Brett, you did, Dr. Miller, you did as well. What kind of metrics are you showing? Obviously, you mentioned Chewy. You're working with a lot of other large employers. What metrics are you sharing to show that kind of financial impact, what the value of the solution is back to whether it's the employer or the patients or the orthopedic groups that you guys are working with? What are some of those metrics that you're tracking and sharing with your customers?
Yeah, there's a lot, and something I've noticed is every employer has different metrics that are important to them, but there are a lot of things. There's overall cost savings. There's return to work metrics as well. There's metrics related. There's different metrics, but overall, I think that if you look at general, what's the focus of this week here, right? It's general. It's healthcare, and one of the things we've talked about a lot is healthcare savings. And making healthcare accessible and affordable for everyone. And I don't think that's a difficult thing to do. So I think those are really important to track.
And again, we started with the first time. If you ever want to do a startup, just talk to me. Again, a decade of my life. It's finally, I get to be on this stage today, but last year I wouldn't have been invited. So I can just tell you, though, you have to have a passion for, and I think everyone in this room is here for that reason. But really, you have to start with your belief and your moral, and your compass has to take you there. Hype will sell you to start. Someone will take a chance on you. Miss Kim Martin did a little bit on us back in the back. But then the hype only lasts so long. Then you have to back it up with data and results. And that's why now we're becoming a data-driven company. We measure, we ask, would you have gone to the ER, yes or no? We're keeping 99% of our people out of the emergency room, but only about 40% would have gone anyway. So you have to, crap in, crap out. The data that we have been making decisions on that's been presented, we have to provide our clients with great data.
Yeah, I mean, really for us, it's about, I think price and transparency equals access to care equals cost savings, right? Pretty simple formula. The real delta, I think, that we're exploiting here is the difference between cost of care in a hospital setting versus an independent outpatient setting, right? And so the people often don't believe me when I talk, I've been at this for a while now, when I talk to industry folks, and they're like, well, I don't get it. Like how, and you all know this because we talk about it all the time, but how can, what do the doctors charge? How do you get doctors to do this? How do you get them to discount? It's like they are discounting off their charge master price just like they do for insurances companies. Like the doctors are getting paid very well. They're getting paid as good or better than their best commercial insurance contracts. And people can't wrap, well, how's my employer going to save money? Because they're not having me operate on them at the hospital, where a wrist fracture costs $50,000 and our clients sell it for $8,000 all day. Like a total knee doesn't cost $80,000, costs $25,000, give or take. And you can go down the road, colonoscopy, all these things. So that's the main metric we show. It's like, hey, this is your average cost. Who cares what percentage of Medicare it is? Because HOPD gets paid more than the independent surgery center. Like the hospital gets paid more for everything they do. The big bad hospital is, I'll reference Kim Martin back there too. The big bad hospital is charging this, and you can buy it for this, and the doctors get paid more. The patient has no out of pocket. The employer saves money. It's just it's amazing. Like why haven't we done this before, right? Like Keith and Jay have been working at it for 10 years. I've probably been struggling on my own, wandering the wilderness of the desert for longer than that. But it's so awesome to be here with everybody who is kind of like-minded and understands that equation can actually work. So anyway.
Beautiful. Well, we are officially out of time. So thank you guys for joining us today. Thank you for everything you're doing to help kind of drive some change. So thank you.